The health sector in the Kingdom has made great strides during the past 14 years as a result of the reforms brought about by the National Action Charter. Mohamed AlShaaban sheds light on the major achievements in this report.
During the past 14 years, the Ministry of Health has made various achievements in the name of providing the best health services to the citizens. These achievements took different forms and stemmed from the policies put forth by the government following the endorsement of the National Action Charter.
There will be more support from the government to achieve all the things that will be needed for the population of Bahrain regarding the secondary health care services. And at the same time that there will be a monitoring, concept of monitoring. So everyone will be involved in that. He will be involved to evaluate what are the services are there. He will just raise it to the concerns and he will share this information with the government.
The ministry witnessed substantial growth during the past 14 years with the expansion of the provision of both primary and secondary health care to the citizens. The ministry worked on establishing various health centers in the different governorates, equipped with the latest medical equipment and increased working hours.
The expansion in primary health services during this era has been tremendous. I think people have noticed that. Also, since the time of 2005, we have expanded the working hours of the health centers. Now all health centers work until 9 and each governorate has a health center working either until 12 or based on 24 hours.
Secondary health services were also considerably expanding since the endorsement of the National Action Charter. This was in the form of establishing new departments at Salmania Medical Complex, investing in training and achieving internationally renowned medical board accreditations.
Salmania Medical Complex, we add about 180 beds in this hospital. And this account like a small hospital in this center or in this complex. There are additional and some centers which are very new for us. For example, renal dialysis or hemodialysis for the patient of renal diseases. There are other centers which are renovated, added for them as an outpatient clinics, for example, psychiatric hospital or Jeddah maternity hospitals.
The Ministry of Health also managed to integrate the use of ICT and health informatics with the application of the iSaha program. The ministry managed to bag first place for Best Government Website in the Gulf in 2013. The wheel of reform, kick-started by His Majesty the King, continues to improve the living standards of the citizens and residents of Bahrain as the kingdom becomes an example of excellence in healthcare and services. Since the establishment of the National Action Charter and the reform project of His Majesty the King, the Ministry of Health has made various achievements in primary and secondary health care for the citizens of the Kingdom of Bahrain. Mohamed AlShaaban, Bahrain Television.